Hello again, and welcome back to the Medical Entrepreneur IV Chelation Training Series. I'm Adam Sewell, MD, and this is video B3, where we focus on one of the most critical aspects of IV chelation therapy, monitoring and managing complications. Before we begin, here's our disclaimer. This video is for educational purposes only and does not substitute for formal clinical training, individual judgment, or regulatory compliance. Always follow your institution's protocols and consult specialists when needed. Let's talk about how to monitor patients safely, recognize early warning signs, and respond quickly to adverse events. Chelating agents are powerful tools, but they come with real risks. Proper monitoring ensures patient safety during infusion, timely detection of complications, protection of kidneys, electrolyte balance, and immune system. Ignoring or delaying monitoring can lead to serious adverse outcomes, including hospitalization or long-term organ damage. Let's begin with the most common and serious adverse effects you should be looking out for during and after IV chelation therapy. Here are 3 key complications you must monitor for. 1. Hypocalcemia, especially with EDTA. Why it happens: EDTA can bind calcium, reducing serum levels too quickly. Symptoms: muscle cramps, tingling around the mouth or fingers, seizures, or even cardiac arrhythmias. Prevention: use calcium disodium EDTA rather than disodium EDTA. Monitor ionized calcium pre and post infusion. Emergency tip: keep IV calcium gluconate on hand during infusions. 2nd, nephrotoxicity. Why it happens: metal chelator complexes are excreted through the kidneys. Who's at risk? Patients with pre-existing kidney disease, dehydration, or prolonged therapy. Signs: rising creatinine, decreased urine output, electrolyte imbalances. Prevention: hydrate well, monitor renal labs closely, reduce dose if needed. 3. Allergic or hypersensitivity reactions. Agents involved: dimercaprol, deferoxamine, and even EDTA in rare cases. Symptoms: rash, wheezing, hypotension, anaphylaxis. Prevention: always ask about allergies beforehand, start the first infusion slowly, and observe. Emergency tip: have epinephrine, antihistamines, and IV steroids available on site. In addition to watching for those symptoms, it's essential to run the right lab tests and to time them correctly. Essential labs to monitor. First, renal function. Tests: serum creatinine, BUN. When? Before therapy begins, and again after several sessions. Why? Early detection of kidney stress can prevent serious complications. 2. Electrolytes. Tests: calcium, magnesium, potassium, phosphate. Frequency: baseline plus weekly or more often if abnormalities are noted. Why? Chelators can pull out not just toxic metals but essential minerals too. 3. Complete blood count, CBC. Why? Some agents like penicillamine can cause leukopenia or thrombocytopenia. When? At baseline and then periodically during treatment. 4th, specific metal levels. Why? To track therapeutic response. Caution: levels can spike transiently after chelation due to mobilization from tissue stores. Interpret with care. Even with monitoring in place, emergencies can still happen. That's why every office offering IV chelation must have a clear response plan and trained staff. Emergency response protocols. Vital sign monitoring. Monitor blood pressure, heart rate, respiratory rate, and oxygen saturation during and after the infusion. Crash cart readiness. Have epinephrine, diphenhydramine, IV steroids, and calcium gluconate easily accessible. Staff training. Ensure your team is trained in basic life support, BLS, and understands your clinic's emergency protocols. Emergency call plan. Know when and how to escalate to EMS or send a patient to the emergency department. After each session, ask about symptoms: fatigue, dizziness, tingling, or rash. Check labs if needed, especially after the first or second infusion. Adjust the plan, change the dosing interval or formulation if the patient isn't tolerating treatment well. Reinforce hydration and provide mineral support if needed. Let's wrap up with a quick recap. 1. Monitor for complications like hypocalcemia, nephrotoxicity, and allergic reactions. 2. Use labs wisely. Check renal function, electrolytes, CBC, and metal levels. 3. Have emergency protocols in place. Your team should be prepared for anything. 4. Follow up after each treatment session to ensure the patient is tolerating therapy and improving clinically. In our next video, Video C1, we'll shift gears and explore the legal and regulatory aspects of offering IV chelation in your practice. I'm Adam Sewell, MD, and thank you for joining me in video B3 of the Medical Entrepreneur IV Chelation Training Series. Stay safe, and I'll see you in the next video.